The signs started off slow for Bob Fry: fatigue, sleeping at work, not being able to sleep at night. And one day, those simple symptoms almost cost Bob his life.
I was driving on a local interstate in the right-hand lane, fortunately, and went to sleep. Car drifted into the gravel and what they call rumble strips, and that woke me up. Fortunately, I only had about 3 miles to go to get to my house. And at that point in time, I called the doctor, and he said, "Get yourself to the emergency room now."
He had something called severe mitral valve insufficiency, and it comes as a result of mitral valve prolapse, which is a fairly common mitral valve abnormality. And in some people, it leads to really bad leakage of the valve. And when that happens, usually people become symptomatic, and their earliest symptoms are fatigue.
And Bob was shocked to learn he had to have surgery immediately.
I had no prior knowledge of any history in my family or in myself of any kind of heart problems. I don't smoke, I don't drink a great deal. I exercise on a pretty regular basis.
But he had the classic symptoms.
A combination of symptoms and physical signs that clue you into the presence of a valve problem. Because a lot of people get tired for a lot of different reasons. But fatigue, shortness of breath with exertion, shortness of breath when you lie down, swelling in your extremities, having to sit up to breathe at night, those are all symptoms of heart failure.
It was his meeting with Dr. Lewis that Bob learned about minimally invasive robotic heart surgery.
The reason you pick a robotic, minimally invasive approach are the following advantages. Number one, when you're operating on a leaky mitral valve, your goal is to fix it as opposed to replace it. And if we do a robotic approach where we make 5 small incisions on the side, we get to approach the mitral valve in its natural lie. It's where and you don't distort the valve like you do when you open the breastbone. And that's led our repair rates to really skyrocket, and our repair rates for mitral valve leakage are almost 100%. Nationwide repair rates are somewhere around 60%. The second advantage is recovery time. If you do it robotically, you can be doing anything you want to in 2 weeks. The other advantages are you tend to bleed less, so there are fewer transfusions, and the risk of infection is lower. If you do get an infection in your wound, it's much easier, not as devastating as when you get one in the sternal bone.
After a short hospital stay, Bob is ready to get back to living a normal life.
I'm not going to say it was a piece of cake, but it couldn't have been any better in my mind than it has been. And every day I feel better.